So this is a very fun part of the IHPI member forum where we recognize and honor colleagues who've had particularly notable impact with their work in policy. And this year, it's my pleasure to present the awards for accomplishments during 2021. This is an award that we've had since 2014 to recognize outstanding faculty whose work has had an impact on health policy or practice at the local, state, national, or global levels. I'd like to thank this year's award committee that included IHPI members Reno Tepernini, Sue Ambell, Pooja Lagassetti, and Andy Ryan, along with Christina Coe from the university's Office of Federal Relations. The annual award, Impact Awards, recognize research that addresses pressing health or healthcare questions and has directly informed health policy or practice. So it goes beyond publishing in academic journals. The recipients of this honor have actively engaged with policymakers or key policy stakeholders. So it is my privilege to announce this year's recipients, Dr. Michael Sjoding, Assistant Professor of Internal Medicine, and Dr. Allison Lin, Assistant Professor of Psychiatry, as our 2021 Policy Impact Award winners. So I'll give a brief introduction and summary of their accomplishments that led to this award. First, for Dr. Sjoding, he's honored for his important work demonstrating the clinical importance of racial bias in pulse oximetry and continued engagement with key policymakers and stakeholders to inform regulatory and technological changes to address this bias. Drawing on his clinical observations from caring for a diverse patient population during the first COVID-19 surge here at Michigan Medicine, Dr. Sjoding led a team to investigate bias in pulse oximetry using Michigan Medicine's electronic health record data. Together, they found that pulse oximeters fail to detect Black patients needing more oxygen twice as often as failing to make this detection in white patients, which has profound implications when using pulse oximetry as a key triage tool in the care of COVID-19 patients. Their work was published in the New England Journal of Medicine and covered nationally and internationally by outlets such as the New York Times, NPR, CNN, and BBC. In January of last year, Senators Warren, Wyden, and Booker formally wrote to the FDA raising concerns about racial bias, after being briefed by Dr. Sjoding and his team. After that, the CDC cited the findings in their update of COVID-19 guidance, and the FDA issued warnings about the accuracy of pulse oximeters. Dr. Sjoding's work has also had an international impact. The United Kingdom's Health Secretary cited his work when announcing a nationwide review of racial bias in medical devices. So, Mike, congratulations, and please join us on the stage.
Thanks, John. Yeah, so I'll just say a few quick things. Firstly, I'm honored to receive this award. I can't thank the IHPI community enough for this honor. I'd like to say quite definitively that I am a product of the IHPI community. So, you know, I was a fellow here in 2013 and 14, 2015. I participated in the master's program as part of the Clinical Scholars Program. I've had incredible mentorship from this community, both faculty mentors and then peer mentors. So really, like, this work that I was able to accomplish, I feel like in many ways was enabled because of that training, and because of the mentorship team and everyone here. And I'll also say one other thing, which is that, you know, it seems like when you read the history of science, like some of the best research is really serendipitous. So for me, that was definitely the case, right? Like, I didn't really plan on having a career studying pulse oximeters and measurement bias in pulse oximeters, but really I was just in the right place, in the right moment, in the right time, with the right skills to actually answer this question in a meaningful way. So again, I think that's a tribute to the community and the training that I received here. And I'll do one other special shout out to my primary research mentor, Jack Washna, who I don't think is in the audience. And so I just want to thank him specifically for his mentorship, sort of who enabled this work. And I think we're all really grateful for his mentorship to our community, and we're sad to see him moving on to another opportunity, but we're grateful for all the investment he's made. So thank you very much.
Well, Mike.
Cool. Thanks.
You. And I'd also like to recognize Dr. Allison Lin. She's honored for her work using large healthcare data sets to identify disparities in substance use disorder treatment and outcomes. She uses these data to develop novel telehealth research interventions to improve access and health outcomes. She brings a unique lens to this work as one of the few addiction psychiatrists conducting health services research nationally. She's improving care in the real world for patients with substance use disorders by translating evidence to inform policy and practice. In addition to conducting this research, she's directly engaged with key stakeholders and policymakers, particularly at the Michigan Department of Health and Human Services and through state and national organizations, including her role as current president-elect of the Michigan Society of Addiction Medicine. She's worked with numerous state and national stakeholders to inform telehealth policy, informing policy changes for telehealth coverage for substance use disorders in California's Medicaid program. Dr. Lin has served as an expert consultant for the National Committee for Quality Assurance and others, and recently developed a toolkit on telehealth for opioid use disorder for the U.S. Substance Abuse and Mental Health Services Administration to inform next steps in policy and clinical care. Finally, Dr. Lin has led key studies on overdose in the veterans population that have informed VA policy and practice. Dr. Lin, congratulations.
Thank you. It's great to see everybody here today. It's funny, this morning I was actually at my other first real in-person event after 2 years as well. And it's really just nice, a breath of fresh air, I would say, to actually be in person, even though most of my research is actually on telehealth. I'm very grateful for this award. Most of all, I want to thank our great team of both collaborators and really research staff. I'm lucky enough to work with a very diverse team, from statisticians to research therapists, and those are the folks who make the work fun and make it worthwhile to write grants. I also, very similar to Mike, want to say exactly the same thing that you did. Apparently, I don't think it's a coincidence, but both of us have been products of IHPI. I went through the master's program. I've been through so much of the training programs. And honestly, it's hard for me to separate kind of the benefits I've gotten from IHPI than any other aspects of my faculty career. Most of all, though, I want to say a special thanks because I think IHPI helps me continue to prioritize impact in my research work. This is not something that comes naturally to some of us. Some of us actually feel more comfortable writing research grants, designing, developing randomized controlled trials. However, I work in the field of substance use disorder care where 90% of my patients do not receive treatment, even though we have long had effective treatments out there that can save lives. And so even though I can spend 5 years to do effectiveness, implementation, pragmatic trials, there are really pressing questions right now. And naturally, I might not be the person to say, oh my gosh, I'm going to tackle all of these things. But due to the help and services of IHPI and helping to disseminate work, help with communications, bridge connections, for example, to the telehealth network here, it really makes it possible, and it doesn't seem quite as daunting. So thank you.
Congratulations.